everyone, welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their neck. And what's going on with these folks, they're having issues with their neck and the pain isn't going away. It's pain in the neck, they've got the massage, they've been doing massages, they've been to the chiro getting their neck adjusted, they're doing exercises, they've been seeing their physiotherapist, their PT, and getting all this stuff done, and their neck is still in pain. So what's going on? What's happening with these folks? Well, here's one reason why we find sometimes is that they're having problems with their gallbladder. And you know, here we are, we live in a Western American diet, and it's not the greatest for us, and our gallbladder flares up. Well, you can look this up in any anatomy book, but the phrenic nerve exits out of your neck. So between C3 and C5. So right in through here, it exits out, comes down, and it innervates your diaphragm. So the diaphragm is the primary muscle that allows you to breathe, right? Well, inflammation of the gallbladder, any kind of irritation there can push up against the peritoneum, part of the, right around the diaphragm, irritating the phrenic nerve, and boom, that nerve refers pain up into the neck where it comes out of. And now, you're getting the neck adjusted and all that stuff. When the problem isn't here, it's way down here in your gallbladder. So, this is what you do. How do you fix that? This is what you do. I have Dr. K here. She's going to be our gallbladder inflammation subject today to help alleviate that neck pain. So you have them, it's easier if you do this with somebody else, to them to stimulate that area of the gallbladder. You can do it yourself too, but here, let's check this out. So I'm going to have Dr. K here lie down on the table, just like this. I'm going to tilt this down just a little bit, just like that. And so this is Dr. K here on the table, and right here is kind of like the xiphoid process in the mid part of her, the end point of her sternum right there. And you just kind of follow that along. This is her right side right here. So the liver kind of spans across this right area right here. And underneath the rib cage, just about an inch or two, right in through here underneath the rib cage, you're going to, in some people, it's going to be very, very sensitive as you palpate in here. And this is kind of where her diaphragm, also her liver and gallbladder hang out. So by just stimulating this area just a little bit, you can have them also bend the knee. That helps. Sometimes if the knee is straight, it puts tension in through here. But by bending the knee, it helps alleviate pressure. And I'm not just digging in there with my fingers. I'm kind of using a nice gentle, this soft part, if you will, or not the pokey part, just like this edge part of my fingers to kind of stimulate this area a little bit, just like this. I don't know if you see that. So right in through here, just like that. And you're going to do this, you're going to kind of massage this area gently for about 30 seconds to a minute, if they can tolerate it. Now, if it's too much, you can back off a little bit and then go into it 10 more seconds. If it's too much, you can back off a little bit and go into it a little bit right in here. But again, the gallbladder, and in some sources, the gallbladder is the sensory part, is also innervated by the phrenic nerve. So, irritation of the gallbladder in that anatomical variant, those folks, if there's irritation in the gallbladder, you eat something funny, then it gets flared up, puts pressure on that phrenic nerve, and that phrenic nerve goes all the way up right here, back of the shoulder. We did a video a little while back if you have unresolved right shoulder pain. A lot of it is due to the gallbladder. Again, we live in a Western diet, not the greatest of diets. We eat bad, and boom, you have problems with your gallbladder. So, but this is specifically talking about the neck. So where it comes out of the neck, that's between C3, C4, and C5. So right in through here, you're massaging this. And in a lot of cases, that right neck pain, gone, just like that. And they've been battling it for sometimes months, sometimes years, just unresolved neck pain. and they think it's a postural problem. They think, they're trying to find solutions. They're taking muscle relaxers, the whole bit, and really what's going on is gallbladder. So, palpating through here, and it's tender on a lot of folks, right in through here. So massage this out a little bit, 30 seconds to a minute ideally. If it's too much, you may have to do 10 seconds at a time and back off. And then over time, that's going to relieve that right neck pain with the person involved. So anyway, this is how to resolve unresolved neck pain. So we want to thank Dr. K for being our gallbladder subject here today. And sometimes you guys will ask, what about left neck pain? So this is the right side. The phrenic nerve comes out the right neck, goes down, innervates the diaphragm, and in some sources it also innervates the gallbladder. But what about the left side neck pain? Well, same thing. If you have any kind of inflammatory response going on over here, sometimes the pancreas, if you have inflammatory response going on over here in the pancreas, it pushes against the peritoneum, up against the diaphragm. Again, the diaphragm is innervated by the phrenic nerve, and boom, you have that irritation up left side neck. You can stimulate the left side, kind of in a similar fashion as the right side. So you massage out the left side of just underneath that rib cage, right in through here on the left side. Again, I'm not poking around my fingers. I'm using kind of my side of my hand here, like this. See that? So I can use just like that. I don't know if you can see that on this side. So just like this, but I'm on the other side. Massaging this side out, and then sometimes almost instantly that left side of the neck that's been unresolved, neck pain that's been unresolved, goes away. So anyway, also one more thing I want to point out is if you have gallbladder issues, you want to make sure you want to check with your healthcare provider for making sure there's gallstones going on in there. Get that taken care of. Also, if you have pancreas issues, pancreatitis, that type of thing, that can be very, very serious. So you want to make sure you want to check with your primary care with figuring out what really is going on with your pancreas and gallbladder with this. But if you find that you're having neck pain, massaging either the left side or the right side underneath that rib cage, if you massage there and alleviates this, well, you're going to know that you have some gallbladder issues, and you're going to know you have some pancreas issues. So get those taken care of. Anyway, we thank you for watching. If you have any questions with this video, drop it off the comment section below. If you're new to this channel, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well and live well. Also, give us a like, give us a thumbs up. It lets us know you care. And I know you know people who have unresolved neck pain. So sharing is caring. Share this with them. That way they have the knowledge necessary to take care of this stuff by themselves. And that way they feel better. And if you know them, once they feel better, you're going to feel better. So anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.